Most people hit 50 and start accepting that their body just doesn't move the way it used to. The stiffness, the shorter stride, the struggle to get up off the floor, they chalk it all up to aging and move on. But here is what almost nobody tells you. Hip tightness after 50 is not inevitable. It is not just wear and tear. There is a very specific reason it happens. And more importantly, there are very specific things you can do to reverse it. By the end of this video, you will know exactly what is causing your hips to tighten, and you will have a simple routine you can start today. So why do hips actually tighten after 50? Most people assume it is just age, but it is not that simple. There are 3 distinct things happening in your body at the same time, and when they combine, they create that locked up, stiff feeling you cannot seem to shake. The first one is something you do every single day without realizing how much damage it is doing. We will get to that in just a second. But before we do, let us talk about what is actually at stake here. Your hips are the central hub of your entire body's movement. When they lose mobility, your lower back starts compensating. Your knees start compensating. Even your posture shifts. So tight hips are not just a hip problem, they are a whole body problem. Now, here is the first culprit: sitting. Modern life has turned most of us into expert sitters. Driving, working at a desk, watching TV, scrolling on the phone, hours pass, and we have not moved at all. Here is what happens physiologically. When you sit for long periods, the muscles at the front of your hips, called the hip flexors, stay in a shortened position. Over time, they adapt to that shortened state. They literally start to think that is their new normal. And once those muscles shorten and tighten, your range of motion shrinks with them. That stiff, creaky feeling when you stand up after sitting, that is your hip flexors pulling back. This is the #1 thing I see in people over 50. Not injury, not disease, just sitting too much for too long for too many years. The second cause is something that starts happening in your body, whether you like it or not, after 50, and that is muscle loss, specifically in the glutes. After 50, we naturally begin to lose muscle mass. It is a process called sarcopenia, and it affects strength and stability throughout the entire body. But the problem with the hips specifically is this. As the glutes get weaker, the hip flexors get tighter. That imbalance pulls the hips out of alignment. And when your hips are out of alignment, the discomfort does not stay in just one place. It spreads to your lower back. It spreads to your knees. Everything starts to feel off. Strong glutes are not just about aesthetics. They are absolutely essential for healthy, pain-free hips. The third cause is one that does not get talked about enough, and it is hormonal. During menopause, estrogen levels drop significantly, and estrogen plays a direct role in joint health and tissue flexibility. When those levels decline, connective tissue loses some of its elasticity. Joints feel stiffer, muscles feel less pliable. This is why so many women notice a sudden shift in how their hips feel during this period of life. It is not in their head. It is a real physiological change, and while we cannot stop that hormonal shift, we absolutely can counteract its effects by keeping the joints moving and the muscles engaged. That is the key. Now here is something important. Tight hips do not always show up in obvious ways. Most people think about hip pain and assume they would know if their hips were the problem. But tight hips are sneaky. They show up as lower back stiffness. They show up as knee pain during workouts. They make it harder to climb stairs comfortably. They shorten your walking stride without you even noticing. They make squatting and lunging feel uncomfortable. And that classic stiffness after sitting for a long time, that is your hips talking to you. If any of those sound familiar, your hips are asking for attention. Now let us get into the part that actually matters, which is what you can do about it. And I want to be clear. You do not need complicated routines. You do not need to spend an hour stretching every day. What you need is consistency with a few targeted movements that address both the tightness and the weakness at the same time. I have seen women in their 60s and 70s dramatically improve their hip mobility in just a few weeks by committing to exactly this kind of simple, focused approach. The first movement is the hip flexor stretch. Step 1 foot forward into a lunge position and lower the back knee to the floor. Gently shift your hips forward while keeping your chest upright. Hold that position for 20 to 30 seconds and then switch sides. This directly targets those shortened hip flexor muscles that tighten from all the sitting. Do this every single day and you will feel a difference within a week. The second movement is glute bridges. Lie on your back with your knees bent and feet hip-width apart. Press through your heels to lift your hips off the floor and squeeze your glutes at the top. Lower slowly and repeat for 10 to 15 reps. This is one of the most effective exercises for reactivating weak glutes and restoring the muscle balance that your hips desperately need. The third movement is the figure 4 stretch. Lie on your back, cross one ankle over the opposite knee, and gently pull the supporting leg toward your chest. You will feel a deep stretch in the outer hip and glute. Hold for 20 to 30 seconds and switch sides. This opens up areas that are often chronically tight and overlooked. The fourth movement is standing leg swings. Stand tall while holding onto a wall or chair for balance, and swing one leg forward and back in a slow, controlled motion. Keep your core engaged throughout. Do 10 to 15 swings on each side. This is a dynamic movement that warms up the hip joint and improves its range of motion without any strain. And the fifth movement is squats. Simple, fundamental squats. Stand with feet shoulder-width apart, lower your hips as if you are sitting back into a chair, and keep your chest lifted with your knees tracking over your toes. Perform 10 to 12 reps. Squats strengthen the hips, glutes, and legs all at once while encouraging healthy joint movement. They are one of the best things you can do for your body at any age. Beyond these exercises, your daily habits matter just as much. If you sit for long periods during the day, set a reminder to stand up and move every 30 to 60 minutes. Walk around, do a few hip circles, give your body a break from that static position. Those short breaks add up more than you think. Walking regularly is also one of the simplest and most effective ways to maintain hip mobility. It keeps the joints lubricated and the muscles active. Even 15 to 20 minutes a day makes a real difference. And adding strength training to your routine, specifically movements that engage the glutes and hips, is essential for maintaining muscle as you age. 5 minutes of mobility work each day on top of that is really all it takes to keep the hips feeling open and healthy. Here is the thing I want you to take away from this video. Your body responds to what you do consistently, not what you do once in a while, not what you plan to do, what you actually do regularly over time. You do not need an hour-long routine. You do not need a gym membership. You just need to show up for your body every day with a few intentional movements. I have seen women go from feeling stiff and limited to moving confidently and comfortably again, simply by committing to small daily habits. It is never too late to start. Your body is far more adaptable than you give it credit for. If this video was helpful, share it with someone who needs to hear it. And if you want more content like this, practical, no-fluff advice for moving and feeling better after 50, make sure you subscribe. There is a lot more coming that I think you are going to find really useful.